You're seriously hurt, in need of trauma care, CRMC is the go-to hospital in the Central Valley. That's why there was concern when reports surfaced over the past couple of days that the hospital was in danger of losing its Level 1 trauma center status. Tonight, the hospital's CEO says that's simply not true. He's assuring the community the hospital will do what it takes to keep doctors on staff and retain the Level 1 status. Our Dennis Valera live at CRMC. And Dennis, is this all about a contract dispute?
Steph, with no contract, a group of neurosurgeons said they will stop working at 11:59 tonight. But a statement from CRMC disputes that, saying trauma services will continue and there is no cause for alarm. For the hospital, this all came out of left field.
And this absolutely breaks my heart.
For 24 years, the Central California Faculty Medical Group, or CCFMG, has provided top-notch care through a contract with community medical centers. But as of September 1st, the contract has expired, endangering funding for 28 doctors. The biggest concern, CRMC's Level 1 Trauma Center, the only one in the region.
We'll still be here. I'll still have people in the hospital 24 hours a day if somebody gets shot or stabbed, if they get in a car crash.
The 28 doctors affected by this represent 12 specialties, so without specialists like neurosurgeons, the hospital would lose its Level 1 trauma status. That would mean that doctors at CRMC would only stabilize patients who sustain brain or head injuries. Then they would be transported hundreds of miles away.
They'll go to San Jose or Sacramento or Palo Alto or San Francisco.
The doctors in question are also staff members at UCSF Fresno, so if they were to leave, the question is, who would train the new doctors?
If we don't have them, then we can't have our training programs. And so ultimately then that, we don't have the specialists now, and then we're not going to have physicians down the road either.
But CRMC says there is no cause for concern and that the expired contracts will not affect operations in the trauma center. They issued a statement that reads in part, Community Regional's trauma services will continue. There is no reason to alarm Central Valley residents or our healthcare partners by threatening a change in access to our trauma services at Community Regional Medical Center. Despite this, CRMC's Chief of Trauma, Dr. Jim Davis, says some of the affected doctors are already looking for other jobs.
I know at least half the neurosurgeons already have their resumes ready to go out to look for other jobs because this has become an unreliable partner.
Now, the hospital CEO says, quote, "It is unfortunate, surprising, and highly irregular for the CCFMG neurosurgeons who work at Community Regional to stop working at such a short notice." Now, he also adds CRMC is working to make sure there is no interruption in care. Live in downtown Fresno, Dennis Valera, KSEE 24, Local News that Matters.